Are you experiencing PTSD? Then you might want to hear about this podcast on MDMA therapy for PTSD. Jill Sitnick will tell us why it's so important to experience it. She's the founder of The Journey Sage, which is an educational platform that demystifies MDMA therapy for PTSD to help dispel the stigma of psychedelics for mental health. So Jill, tell us, what is MDMA therapy and what is PTSD? Heal podcast with Lily Patrascu shares longevity and anti-aging techniques to stay young forever, increase energy, overcome addiction, and live your longest, best life ever. Shared by world's most innovative, alternative, and traditional health thought leaders, healers, and doctors. Discover quantum healing strategies to heal your mind, body, and soul.
PTSD is very often associated with folks who go to war, folks who are in battle, who have had a very traumatic experience. In addition, anybody who has experienced trauma as a child or been in some sort of traumatic incident can experience a post-traumatic stress disorder. And that basically shows up in forms of a lack of control, hypervigilance, massive depression, a feeling that the universe is against you. And so that's what I experienced in my late 40s due to some childhood trauma. MDMA therapy was delayed in the US in August 2024. So it has 3 clinical trials behind it, where approximately 2/3 of the participants in those trials no longer qualified for a PTSD diagnosis, but yet things were delayed with our FDA in August. Australia right now is the only country that actually has it legalized where you can go. But there's a pretty robust underground of practitioners and facilitators. My therapy was done underground. And I like to share my experience because I think it's really important for people to know that this option is coming down the pike, what it is, what it entails. It's not turnkey. It's not a magic pill. So that's what I do. I talk about my experience to help people in the future.
Thank you. Tell us more about MDMA therapy and why is it so important for people to explore what it can do for people experiencing trauma?
So MDMA is an abbreviation for a massively long word that I cannot pronounce it. There's no way. The street name for MDMA, most people will recognize as ecstasy or Molly. So usually that puts it in context. When MDMA is used therapeutically at a therapeutic dose, it allows for the patient's trauma and fear to kind of relax. And I always put my hands on my shoulders because I think I was living like this my whole life. It allows the body to relax. It decreases the fear response and allows a patient to start analyzing and going back and looking at the traumatic memories and changing the perspective that my 230-pound, 6'2" father beating me when I was 3, that was not my fault. That was not about me. That was about him not being a capable parent. And changing that perspective from the very, very inside of your subconscious. Psychedelics allow you to create new neural pathways. And almost memory by memory, that's the healing process.
Wow, that is fascinating. Okay, so tell us what scientific research or what research is there to support that this is actually the case, that MDMA therapy does work for countering the impact of PTSD?
Fantastic question. When my therapist suggested, first of all, she gave me the diagnosis of PTSD, and then she suggested MDMA therapy or psychedelic-assisted psychotherapy, I was like, no way. I had too much neon in my head. I was like, I'm not doing that. Have you met me? And at the time, the MAPS organization, MAPS.org, or get ready, this is a mouthful, the Multidisciplinary Association for Psychedelic Studies. At the time, when I was in my late 40s, they had already completed the phase 2 clinical trial, where again, approximately 2/3 of the people no longer qualified for a PTSD diagnosis. That's what encouraged me to move forward with the therapy. That organization has since completed a stage 3 clinical trial. Again, it went to the FDA in August. The FDA said, wait a minute, we needed a little research. In response, not only has MAPS been fundraising, but in the US, our Veterans Association, because they know how powerful this can be for veterans, they are funding their own research so that they can turn around to the FDA and say, hey, look, it does work. Please approve it, and let's get MDMA no longer being a Schedule I drug so people have access to it to complete this therapy.
Wow, that's so fascinating. I'm wondering about the what do you call it? The effect of MDMA, even if you were to use it in small doses, on long-term addiction.
That's the best part about MDMA. It is not a substance. One of the reasons why it's used as a party drug is that it is not inherently addictive. You'll often hear of the MDMA hangover. If you've taken too much, you feel kind of yucky the next day or two because you've had too much serotonin released in the brain. And so the next couple of days, you're feeling a little bit down because your serotonin stores aren't, ready to go. So it's not the kind of thing where, oh my gosh, I felt so amazing, I'm just going to keep taking it and keep feeling amazing. There's definitely what people often call a come down kind of situation. In addition, when you're using it therapeutically, you are in a therapeutic relationship with a practitioner, therapist. And so if you're taking it seriously, you are preparing for at least a month or two before the session, hopefully with someone with whom you've worked. You're having the medicine day. And then the 2 to 3 months, for me, it was 2 to 3 months in the clinical trials. They had to condense, they only used 1 month. You're actively healing your trauma memories during that time. I had 3 MDMA sessions over the course of a year, anywhere from 2 to 5 months apart. I'm not saying that anybody can't get addicted to anything. MDMA is not an inherently addictive drug and would not produce that kind of response if used in a therapeutic protocol.
Thank you. What are some potential side effects or negative impact on cognitive function or like long-term impact for having used this even in a small dose? Are there any potential side effects?
So let's have this conversation, because anybody who is looking at psychedelics at all, magic mushrooms, MDMA, LSD, they should always be screened. So anybody with a history of psychosis, anybody who has schizophrenia in their family, absolutely psychedelics, a no-no. Don't go near them. I was additionally screened specifically for MDMA because it's got methamphetamine in there. There's a little bit of an upper going on, even though you're taking a very low dose. So anybody with a heart issue should not be taking MDMA. So I didn't have any issue. I was screened. I don't have any of that background. My heart is fine. And there is no clinical research tracking that consistent use of MDMA is creating any sort of cognitive issue. And again, especially if you're using it therapeutically, you may only use it 2 or 3 times over the course of a year. And as long as you are screened and cared for, it's not producing that. One of the reasons why I talk about this stuff, I demystify what MDMA therapy is because all the stereotypes, drugs are addictive, drugs are bad, drugs are harmful. Well, I could go drink 20 Diet Cokes a day. Bad things are going to happen. So you always have to keep in mind dosage, usage, what your health is to begin with. But MDMA therapy inherently does not carry the dangers that we classify drugs to have.
Thank you. What are some positive effects that MDMA therapy could have on PTSD long-term? And I'm thinking, let's say if you're dealing with a veteran who, let's say, has, at least 500 traumas of different kinds. And maybe even, let's say, an abused woman who was always beaten has also potentially 500 traumas of different kinds as well. What kind of results could someone expect to get from leveraging MDMA therapy to cope with PTSD?
So what it does, and I love the fact that you just validated for folks that trauma is not just one particular incident. I was abused as a child up to age 19. I had years and years and years of trauma. The reason why MDMA therapy works beautifully for PTSD sufferers is because usually when people are in a PTSD spiral, they're kind of not functioning from a cognitive, logical way. They're functioning from their body being really scared. Think about you're at the top of a mountain or on a really tall ledge and you're scared of heights. Your body is going to be feeling that. Imagine that sensation all the time. And that's what a PTSD spiral is. So MDMA, by kind of increasing the amount of serotonin, the feel-good chemical, allows you to actually kind of bond and feel safer with your doctors. By the way, a therapeutic day with MDMA is 1 client, 2 therapists. So you're very well taken care of if done appropriately. And it not only kind of allows you to bond, it also decreases the fear response. So I was able for the first time in my life to share openly that I was afraid if my father was in the room, he would have his hands around my neck. And that's not something in a non-enhanced state that I ever would have admitted. I wouldn't have been able to get there, but I was able to admit I was deathly afraid of my father. And in the days and weeks after the MDMA journey, that's when the healing happens. That's when the memories come up, the traumatic memories, and you start to reshape them and look at them and say, wait a minute, is that really how it happened? Wait a minute, do I really need to be scared of that? You start to shift your reality. It's memory by memory. And so veterans who have been in a lot of battles can very often kind of revisit and realize, wait a minute, a lot of things were out of my control. And do I really need to be taking responsibility for this? And the guilt and the shame that kind of comes around with survivor's guilt, I hear a lot about. So it's all about shifting perception. And not that other psychedelics can't also do that. They can. MDMA is beautiful if you're like me and you're just, I was suicidal and my body was just like on edge, hypervigilant constantly.
Thank you. Why does changing the perspective on what happened work when you were leveraging MDMA therapy for PTSD?
Oh my gosh. So I want you to imagine a memory that really scared you, right? And then I want you to just imagine with me that all of a sudden that memory is just a memory and it has 0 emotional attachment. It's almost like when you go to a movie and up on the screen, all those emotions are like a big 10. Like if you're watching a horror film, that person in the horror movie that's like facing the chainsaw, their emotions are a 10. But you're sitting in the audience and your emotions are like a 2 because you know it's a movie, right? That's how it is. The shifting of perspective of, wait a minute, this wasn't my fault, or let me really look at how this went down, and shifting your perspective, therefore shifting your emotional attachment to that memory, that's where the healing happens. My mother shot herself when I was 5. My father beat me repeatedly. I can now look back on those memories. I'll never lose those memories. They're mine. They just don't have the emotional attachment anymore that they once did. It's almost like, it's kind of like a separate life. That's the healing part.
Thank you. Tell us what you've been able to do since doing this MDMA therapy for your personal PTSD. How did that change your life in terms of what you were able to achieve or, I don't know, maybe see now as possible?
Well, considering that I was suicidal going into MDMA therapy, because I had done the traditional talk therapy and antidepressant. I had done the traditional methods and they were not working. I also had a question once about what the color of your future is. And even though I love black, black's like one of my favorite colors, I actually couldn't see a future. My future was black. I didn't see it. And after the therapy, about a month after my 3rd journey, so after the full year, I had that question posed to me again. And suddenly my future had a color. It was like a hazy kind of pink. And that was the beginning. It was a really interesting kind of data point that suddenly I could see there was a future. and like my future was not empty. And I think that's one of the other things that MDMA therapy allows a PTSD patient. You can see the future, you know, you have a future, you know, you have an element of control, and you're allowed to have joy come back into your life. So living life to the fullest. It's kind of it's an odd thing to tell someone who hasn't had PTSD, hey, you get to feel joy. But for someone who's experienced it, they know the absence of joy very, very well. And so this allows you to take back that kind of emotion.
Thank you. How many times do you have to do the MDMA therapy under how many times and for how long so that you can have the best results? Or is a customized program required for every person based on their own personal trauma?
Well, you know, it's an interesting question. The clinical trials, because they are constrained financially, they only gave 1 month in between the therapeutic journey. And just to level set that a therapeutic journey is 1 full day. It's on average 5 to 8 hours with the client and 2 professionals. So think of it like a surgery day. Like that's how important it is. The clinical research does have 3 therapeutic journeys to kind of get to the end of PTSD. But remember, it was about 2/3 of the patients who no longer qualified. So I do have to wonder if those particular folks just needed a 4th one to kind of get them over the edge. My personal opinion, and I'm not a doctor, my opinion, a dollar bill doesn't even get you a cup of coffee anymore. My personal opinion is that it will be customized, and hopefully insurance will help, because obviously I just talked about how expensive it's going to be with 2 practitioners, 1 client, an entire day, and then talk therapy before and talk therapy after. Did I get every part of the question, or is there a part of the question still hanging?
Yes. Is MDMA therapy for PTSD, is it legal in the US to do? Or?
It is. Right. It's not. Not, because in August, the FDA delayed approving it. The only country where it's legal right now is Australia.
Mm-hmm. Okay. What else would you like people to know about MDMA therapy for PTSD?
I would like people to know that it's just the start. If you are interested so just to let people know that our FDA gave breakthrough therapy designation to MDMA for PTSD, LSD for hard to treat anxiety, and psilocybin for depression. So psychedelics are being studied pretty extensively, and there's millions of dollars in investment in companies that are working for a psychedelic treatment to help folks. Go look at clinicaltrials.gov to see all of the clinical trials that are being reported, or you can do an internet search. Within 5 years, I would anticipate we're going to have a number of mental health solutions that we don't have right now.
Thank you. Are you currently a practitioner of MDMA therapy for PTSD, or are you sharing this just from the perspective of a patient?
I am not a practitioner per se. I am not a therapist. I just went through Third Wave's psychedelic coaching program to complement my other 2 coaching certifications. And I'm actually running retreats. I have a women's iboga retreat coming up. Iboga is a different kind of psychedelic, coming up in July, and my own psilocybin retreat in Mexico in October. MDMA isn't great for retreats because you can't do it multiple days in a row, whereas other psychedelics allow folks to experience a lot of self-growth because you can have multiple applications within a week.
Thank you. Tell us, why is it so important for more people to know about MDMA therapy for PTSD versus other, psilocybin and the others that you mentioned that could also help for other conditions?
Nicely done there. I know psilocybin's a tough word for folks getting it for the first time. I think I was heartbroken when the FDA delayed in August, because in the United States, there's a really chilling statistic that on average 10 to 15 veterans a day commit suicide. And that's not even counting the domestically abused women, people who've been in an attack, people who are suffering from trauma. And so I think it's important that people know that this is on the horizon, either for themselves or someone else, because right now we don't have really good solutions for a lot of these mental health challenges that psychedelics, as per the clinical research so far, show to be very promising.
Thank you. Tell us what else could help for PTSD aside from MDMA.
Yeah, so I always tell people, especially if you're in a PTSD spiral, like I was, like I was just hyper vigilant. I wasn't sleeping well. My stomach was upset. I was constantly looking. It was like I was running a race with 100-pound rucksack on my back, and I was never going to win, and I was getting really, really tired. That's not the time to be looking for psychedelic-assisted therapy. I always tell people, go get into therapy. Get the traditional antidepressants. I was on Wellbutrin. Go the traditional route, start getting comfortable with talk therapy, start getting comfortable with what your issues are. And then you can pursue psychedelic-assisted psychotherapy in addition to the talk therapy relationship that you've already created. I see too many people thinking that psychedelic-assisted therapy is just like, going to somebody's office who you've never met before and just sitting there and getting, getting high. That's not how this works. This is as important as like a surgery. And we all know how much time it takes to schedule a surgery and the prep and all that kind of stuff. So I always tell people, go the traditional route, take your time. Going into psychedelic assisted therapy when you are in a crisis can actually elevate the crisis. Sometimes psychedelics can emphasize. And so you want to be really careful and be very, very prepared. And that's one of the reasons, like, you can go on my YouTube, you can get a ton of information. I really take the time to explain it to folks, because you're already suffering. There's no reason to get into a healing modality that you're not quite ready for.
Thank you. Are there any simple things that people can do to kind of come back to, joy from after suffering from PTSD? I don't know. Is it like something like, walking or, doing simple things that could also help them towards that, having that therapy for PTSD?
Well, I think that differs for everybody. I think it also depends upon the severity of what someone's feeling. I think it's always important for individuals to find what works for them. I'm a D- meditator, but get me walking and I can process until the cows come home. So I always encourage people to find their kind of integration partner, or what grounds them or what makes them comfortable. I hate being told how to breathe. So people are always like, box breathing. Like, I hate that, but you might love it. Absolutely find those self-care, I don't want to use the word hobbies, find those self-care strategies that work for you. If those aren't working along with talk therapy and maybe an antidepressant, or you're getting worse, that's when you start looking at psychedelic assisted therapy. You go on retreats when you are your nervous system is good. You're just looking for self-empowerment. You need to make some choices. You're looking to get over something, maybe, a traumatic death or a divorce or something of that sort. That's different. PTSD is pretty serious. People commit suicide. So I always encourage self-care, but I would not rely on it alone for that particular mental problem.
Thank you. What does the research say about the relapse in terms of people that have experienced MDMA therapy for PTSD?
So the research is relatively new because it went to the FDA in August, but they've been doing their clinical research since 2017. I think what's really important is that I'm not sure if the research shows that there's a recurrence in PTSD symptoms. What I will say is that those 3 MDMA sessions over the course of a year for me qualified me to no longer have a PTSD diagnosis. And I still had 19 years of trauma to heal. So I continued my talk therapy. I continued working with psychedelic medicine. I went on retreats. The same way people go to the gym and work out their body, I enjoy working out my mind. So I don't want anybody to think that 3 sessions, you're healed with PTSD and all your issues are gone. Depending on your background, you might find that you'll continue working with either MDMA or another psychedelic.
Thank you. What should people do to start healing their mind while coping with PTSD? You said talk therapy. Is there anything else that they can do?
I would say get some support. A lot of times PTSD in especially situations like mine, but I've also heard it from veterans, there's a lot of shame. There's an awful lot of shame involved, and shame can't live in the light. Shame lives in the dark. So one of the best first steps is start talking to somebody, get in a community. One of the reasons why veterans like talking to other veterans is because they had this very similar experience that I can't relate to. The same way when I meet somebody who had a very disruptive and abusive childhood, we kind of bond instantly because we get it. Whereas people who had great parents are kind of like, why do you keep talking about your dad so much? So find a community, talk, be brave, voice that shame, because I guarantee to you it's a 10 and to other people it's like a 2. It's just the way that shame works. And I can't tell you how many times I was like telling my therapist something really shameful and just kind of looked at me like, okay. So yeah, that was one of my takeaways. The shame is very personal and usually cannot live out in the light once it's communicated.
Thank you. For people that want to find out more about how you can help them with PTSD or other illnesses, where can they go?
Go to thejourneysage.com, and I'm happy to answer questions. People can go right on my calendar and I can answer questions kind of like what we did here. And then if people are not in a PTSD spiral and want to kind of explore other things, we can talk about retreats. But I don't mind talking to people about this because it's so new and answering some questions. They can also go to my YouTube channel. I've got over 250 videos talking about this therapy, so that can help folks too.
Thank you. Follow me for more interviews with world's most innovative health change makers to live your healthiest life ever.